I'm Mike Daly, retired CEO of Baystate Health System in Massachusetts. And as I consider the health reform activities that you are dealing with in attempting to reform the system, I'd like to emphasize the problem of the primary care numbers of physicians and their distribution across the country. I think dealing with the issue of the uninsured is important. But it doesn't solve the issue of access. And unless we allow these people who, once they obtain insurance, to be able to actually see a physician, we haven't solved any problem whatsoever. And so my emphasis right now would be on understanding why primary care physicians are in such a shortage. And that goes back to the disparity of income expectation between specialists and primary care physicians. I think in the reimbursement model that has to be carefully examined, and there should be some equity restored to the way these physicians are paid. Unless we deal with the money issue, the primary care problem will not be solved. And I think if we can address that seriously, the other key, critical, difficult components of the healthcare reform issue will be somewhat easier to address, because I think the physician distribution of income expectation is one key critical step around getting reform into this system. So that's what I would urge the policymakers to examine and understand, because it's a very complex issue.